Hi, Vicki. Welcome.
Thank you. Eventually. Hi.
You did it. You did it. What time is it where you are?
It's actually just gone 8:06, but I had problems with the internet, so I had to relocate.
Ah, yeah,
Oh,
somebody else was having trouble getting in as well. So
it's
I've got a,
ridiculous.
I've got a couple of other people who said they were coming. So we'll
All
just
right.
just chat a little bit while we're waiting. And
We can do that.
yes, we'll give them at 7 minutes past. So we'll give them a couple more minutes and then we'll just roll on. So
Okay, okay.
Vicki, and Nicole is also here. She's a local girl. She's an Aussie. Um, and
Hi,
Nicole's
Nicole.
Hi.
Nicole's just been telling me about her shoulder woes. What's happening for you? What are
Ah,
we working with? Was it you that asked for tendonitis and bursitis?
no, but I think it's probably tendonitis
Uh-huh.
um, for me. Um, it probably stems back to a car accident that I had many, many moons ago because I've got issues with my hip.
Yes.
And for a long time, I don't know, you cope, you get distracted, life's very busy, it's hectic and
Yep.
so forth. But like Jacine, I'm actually, and as you know, I'm doing Qigong as well. That's releasing a lot of things.
Uh-huh.
I've not, my shoulder just continues to raise. I've constantly got a dull ache underneath my right scapula that emanates around the ribs. So when I breathe, and it's just
We were just
constantly there,
talking
Vicky.
about this, weren't we, Nicole?
Yes, it's 4 people in 2 days.
Yeah.
Great. So
Okay.
I'm in the right spot then, and I'm
You
not alone.
definitely are in the right spot. You
Excellent.
definitely are in the right spot. So, yeah, this is something that I hear about and see quite often. Hi, Maggie. Welcome. We're just having a little bit of a chit chat at the moment. Yeah, so it's something that I see quite often. And it's very easily addressed once you know what the problem is.
Ah,
And so May, I'm going to get started. So can you let anybody else in as they come? Can you see them as they come in? Just give me a thumbs, just give me a reaction in the reaction thingy. Give me a thumbs up or something so I know that you can see when people are coming in.
Do you want us to mute ourselves?
No, no, this is May or Rogerland. I call her May. Um, so I can't see that. Okay, so May, can you just unmute and let me know whether you can see the participant list and see when participants are in the weight room? I do not see them coming. Okay, all right. I will keep that window open so that when people come in, I can let them in. Okay. All right. So welcome. It's so nice. It's so nice to be here. So if, we'll just pop your microphones on mute for the moment and unmute them if when we've got questions and things. It just means that the quality of the recording is better. So 'cause there are a couple of people who are not able to come who want to be here, and I have promised them a recording this time. And so if we don't have background noises and people shuffling papers and cups of tea and whatever, it just makes for a better recording. So thank you so much for that. It is so much fun doing these little workshops because I get to talk with people that I would normally never see and show you how we can start to resolve some really nasty issues over the internet. No time traveling, no time waiting for appointments, and getting straight to the issues. And so when I first started working with Ortho-Bionomy, which was a long time ago, I might say, it was 27 years ago, and I've been working with this particular modality, which is an osteopathic-based modality, for since 1997, and have had amazing results in the clinic. But then 2020 happened. I also got an injury at the same time, which meant I was having trouble standing and walking. I fractured my ankle really badly, and so just turn my phone away so it's not distracting. And I couldn't stand or walk, and so I couldn't run my practice as well. So there was this, double jeopardy. And I decided to try and see if I could work with people online to help them understand, firstly, what Ortho-Bionomy was about. What is Ortho-Bionomy? We'll answer that in a tick. And also, how can it help? And who can it help? And so that's how my online work started. But way, way back, I wanted to be a nurse. It was the only thing I ever wanted to do. And I did my nursing training, and I got injured a couple of times. I had 2 nasty falls on wet floors. I worked in a beautiful old hospital. The hospital's still there, but that old building is gone. It's been razed, and it's some great, multi-story thing now. But we used to have polished concrete floors, and they would polish the floors every single day with these great big rotary polishers, big old-fashioned things. And they were really shiny, really smooth, really clean, and as slippery as when they got wet. And I had a pair of nursing shoes which had these new synthetic soles. We'd only ever had leather soles up till then. We had these new synthetic soles. Well, no one told me that they were like ice skates when you hit water. And the meals used to come in a mobile bain-marie, and it was leaking. None of us knew. I hit the water and went down like a ton of bricks. Kept the meals, but didn't save myself. Hurt my neck, but 16, about, you don't take much notice of that sort of stuff. And then I did the same injury on the ice skating rink, but this time my head was turned, and that one really hurt. I recovered after a couple of days, all was fine, but about 10 years later, my son was born, and he was not well, unfortunately, and had 3 really major near-death experiences, surgery, and all the stress that goes with all of that over a period of 6 weeks, 3 surgeries, lots of we don't know if he's going to make it sort of scenarios. And he was in a lot of pain and screamed constantly. So here I am, brand new mum, sick baby, screaming baby. Husband was busy at work. Didn't want to come home. And so I'd be with this baby from 7 o'clock in the morning till 7 o'clock at night, beside myself. Nobody wanted to come and see me because the baby screamed the whole time. And I was stressed out of my mind, and I was carrying him constantly because he was obviously really, really unwell. And that was the tipping point for my neck and shoulders. They did not recover from that point. And so for the next 10 years, I sort of got on with it, and then it started causing me problems. I was getting treatment every fortnight. And the treatment kept me at work. I became a single parent in the meantime. My husband, busy at work, turned out to be something else, not at work. He was busy at something else. And it's how life goes sometimes, and you just got to get on with it. And so I was starting to get real issues with my neck, and I needed to be able to keep working. And so I was getting massages every fortnight, remedial massage, which I don't know if anyone here has had a remedial massage for their neck and shoulders. It's not a picnic. Like it hurts. So I'd been used to getting this sort of treatment, and it kept me at work, but it didn't make me better, and it didn't stop me from getting re-injured. And then one day at work, I'd already injured my right shoulder. I'd torn a deltoid, and I was having tennis elbow and wrist problems, so I couldn't open a drip bottle, open a child-proof medicine bottle, which they all were back in the 70s and in the 90s, sorry. I couldn't make a bed. Sometimes I couldn't even pull up my own knickers. I had to use my left hand to pull my panties up. It was getting to be a real issue. And then I tore the biceps on my left side. And now I had two arms. This one I could move, but I couldn't use. And this one I had hardly any strength in my hand and I couldn't move it. And I was in a heck of a lot of pain by now. And it was then that I got referred to someone who worked with Ortho-Bionomy. She was actually an osteopath. It's an osteopathic treatment, but very few people know about it. I had no idea until she started working with me, and I nearly fell asleep. It was so comforting, so relaxing. And I'm thinking, I don't know how this is going to do anything. But when I got up, I realized a lot of the tension had gone. And after 3 sessions with her, I had about 50% of my strength and my power back in my hands. And I was willing to pay attention. It's like, I want to know what this is, because I had started losing faith in the nursing profession. I'd seen the shift from patient care to budget. And the Hippocratic Oath, which is what I believed in and still believe in thoroughly, above all else, do no harm, and, be the best carer, provide the care that the client needs. That wasn't happening. And I was starting to feel that pull. And I was introduced to Ortho-Bionomy, and straight away I signed up. And I went to a weekend workshop and loved it so much I signed up for 5 years to do the training and became an advanced practitioner. And that was 1997 was my first class. And it took 5 years. So in 2003, I became registered as an advanced practitioner. I've been doing it ever since. And so that's my background story. And my injuries have been one of those blessings in disguise. Because if I hadn't been injured, I wouldn't have discovered Ortho-Bionomy. And so the story goes. And so I'm just going to see if I share screen. So May, can you share the slides? So we're going to see if this works. Okay, yes, good. Okay, great. All right, let's see if this works. So sometimes it just helps if you've got some pictures. So one of the most common frustrations for people, can you guys see that? Can you see that? Beautiful. So one of the most common frustrations is that one of the reasons why we get injured is there's old injuries, like I had. I had old injuries, everything was fine until it wasn't fine anymore. And then sometimes we have weaknesses and imbalances. So, if you've got, I see this a lot with office workers, is our shoulders start to raise up and forward because we're doing so much forward work. Our shoulder blades aren't sitting in the right place, and we get that pain that you were talking about, Vicki, underneath the shoulder blade that comes all the way around, makes our shoulders really weak and causes pain. That's one of the things we see, but that's a misalignment issue and an imbalance issue, and that causes injuries, and they're easy to fix when you know what they are. The other thing is what I talked about earlier, home and work stress, and that is, family stuff, just your ordinary old everyday stress, but then there's also autoimmune stress. A lot of us are walking around eating foods that don't suit our body. There's most of the stuff in the grocery store, I don't know if you've noticed lately, is not food. It was not food 60 years ago. I used to go to the grocery store and do some shopping for my mother, and there was fresh vegetables, there was flour, rice and that sort of stuff, and some tinned foods and some frozen foods, and that was it. There was none of this aisles and aisles and aisles of packaged food and drinks. And I just was in the shopping centre the other night, and there were about 10 aisles of non-food. It's scary. And we don't even realise how much non-food we're eating until we get really sick. May, can we have the next slide? And so what's going on when we do get sick? What happens is we become a product of the system. We go to the doctor because we've tried to fix it. It hasn't worked. Doctor says, oh, well, let's take some pills. Let's take some anti-inflammatories and we'll take some analgesics. And that doesn't work. So then you're sent off for an X-ray or an ultrasound, and you have to come back for the tests. And then there's the, oh, well, maybe we need to send you to a specialist or a physiotherapist or this or that or something else. And so then you're off again. Quite often, you're actually not getting an answer to your problem. You're just being sent around in the system. And we feel trapped. Like we don't know a way out. We don't know a better way. And we feel quite powerless because we don't have a way to have that conversation where we feel heard and we feel understood about what's going on. I've had clients in here who have been trying to explain what their problem is to really good, well-trained practitioners for 6 months. No one's listened. And they get here and start telling me the story, and I say, well, have they done, what sort of treatment have you had on this area? No one's treated that. They've been treating this. And okay, well, let's treat the thing that hurts. Funnily enough, they get better because someone bothered to listen. And quite often what happens if you get caught in that system and it keeps going, there's this sense of overwhelm. Like you get lots of different advice from lots of different people, and then suddenly you don't know what to do because nothing seems to be working. You can't do your usual things around the house. You're tired, you're exhausted, you're cranky, and you start feeling guilty because you're not the person you know that you usually are. And sometimes, like I was, you lose your job and then you don't have an income. May, can we go to slide number 10? The issue that we have with most of the treatments that are available is that they're treating the thing. You say, I've got a sore neck. So they come and try and, do doing the massage or do the jibby jabby, we'll give you a crack here or a thing there. There's very few who actually go to the mainframe, to the nervous system and start working with the messages that the nervous system is sending back. If you've got chronic pain, if you had pain for more than 6 weeks, then that message is going back up to the brain, and the brain is now registering it as a threat. It's no longer pain. Pain is a verb. The body is sending pain, which is a verb, back to the brain to say, hey, do something about this. This is a problem. When nothing gets done, all of a sudden, after 6 to 8 weeks, it turns into chronic pain and the brain registers it as a threat. And so our body starts going into fight, flight, freeze, and fawn. So you'll have days when you just burst into tears. You have no idea why. Other days when you just sit staring into space because you just don't know what to do. Other times when you fly into a rage and you think, oh gosh, that normally wouldn't upset me because you're trying to protect yourself. And some other times when you just want to go to bed and hide because you just have no energy left. And that's all signs that the nervous system needs to have some treatment. It needs to be treated first, and then we can start working with what's happening to the body because the nervous system's controlling all of that. And that's a lot. Next slide, thanks, May. So inflammation is one of the major causes of pain, and that's actual inflammation, direct inflammation in a joint because of old injuries, could be misalignment, could be allergic reactions to food, whole lot of, there's a massive range of things that can cause inflammation. And unless we deal with the inflammation, then the alignment's not going to stay in place because you get all the swelling and everything that goes with inflammation. Next slide, thanks, May. So pain and inflammation is a domino effect. It doesn't happen overnight unless there's been an accident and you know exactly what's caused that. But chronic pain certainly doesn't happen overnight. And one thing leads to another, leads to another. So we need to sort of figure out what's actually been happening, do some deep research, ask some really deep questions, start paying attention, become really aware of what's happening in the body so that you can begin to become more of your own healer. And that's my whole philosophy, is once you know how to look after your own self or start to pay attention to what's going on, then you have more control over your whole being. Next slide, thanks, May. Once we have all of that information, then we can start really getting in and fixing the problem. The alignment is easy to do and it's easy to keep in alignment. We start to understand how we're walking, how we're sitting, how we're sleeping, how we're moving, and how that's affecting our symptoms and how it's making it better or worse. And so it's a simple method, but it's a really complex method as well because there's so many parts. But the simple part is that the body tells us, the body's talking to us all the time. When it hurts, it's saying, don't do that. When it's comfy, it's saying, oh, give me more of that because that's helping me get better. Unfortunately, most treatments take us into, oh yeah, that hurts. We just got to push past that. You got to stretch that. You got to do more of these things that don't feel comfortable because if you don't, you won't get better. With this work, we're always looking for the place of comfort. And as we do that, we retrain the nervous system and we also retrain alignment and we retrain posture and our emotions and everything else all at the same time, but through comfort. It's a completely different philosophy, but we're using the body's wisdom instead of trying to overpower it. I think that's it. We're on slide 13. I think that's the last one. So yes, is there one more? Is that the last one that we're going to look at, May? I can't see them from here. I can't see the next slide. I think it's the last one, or is there one more? Yes, this one. So yes, this is when once we know what's going on, we get a really good view and we can put it all in perspective. Then we have a pathway. We can see what obstacles to avoid, what works, what doesn't work. And so then we're on our way to a better life. Thanks, May. You can stop sharing now. Thank you. It worked. Had difficulties with sharing technology before. And so, yes, slowly getting there. So who would like to have a little bit of an experience of what it feels like? Maggie, are you able to stay for the whole session or do you have to go soon? 10 more minutes. So Maggie, just unmute yourself. Maggie's been a client of mine for a little while. And a lot of people, when they hear about what I do, they think, I'm not quite sure how this is going to work for me because, you know, I'm a complicated case or I've tried all of these things. So Maggie, what's been your experience? Tell us a little bit about, just a short about what was going on with you and how it's been for you with working with the system.
My name's Maggie, as you know. I have had pain in my body for most of my life. I've always had hip and shoulder pain. I can remember even in primary school sitting there like,
well, yeah, and never was really diagnosed. My parents thought it was growing pains, as they used to back in those days. But in my 30s, excuse me, I had a bout with Ross River virus and was then diagnosed with chronic fatigue, and then on from that, fibromyalgia, and then spondyloarthropathy, which is a soft tissue disorder of the joints. So I think that various stressors in my life kind of started the ball rolling towards all that. So my life I was constantly like this because I was in pain in my shoulder. I could, if I overexerted myself, I'd wind up in bed for a week, unable to do anything. And I had given up. Like, doctors would throw antidepressants at you because, of course, you're a woman, so you're neurotic and hysterical. Sorry, my dog and cat are having a brawl.
We can't hear them. It's okay.
It was a great crash then. So anyway, I gave up going to doctors. I was sick and tired of being X-rayed, MRI'd, poked and prodded, and then told, okay, well, here's some Xanax, go home and, cope. Then I met Vicki through a mutual acquaintance of ours, a lady that I was seeing for massages, which were really helping. And I heard Vicki talking a few times about ortho-bionomy. And because I come from a fairly academic background and a nursing background, I was like, I've never heard of that. It's a hogwash. But then Vicki offered on her webpage, Facebook page, a 5-day free challenge. And I went and did some research and I thought, oh, so ortho-bionomy comes from osteopathy. Now, that's something I've heard of, and I know that that's an effective kind of therapy. And I thought, you know what, it's free. I've got nothing to lose. And so I decided to sign up for the 5-day challenge. And in that first session, I think the word that I kept repeating was, wow. Because instead of having to twist myself all in knots and do this, that, and the other, it was just really gentle, not going to the point of where it hurts. If you went to the point of where it hurts, you had to pull back and do less. But my shoulders after that first session were relaxed for the first time in, years. So I kept at it, and at the end of the 5 days, I'd seen so much improvement in my hips and shoulders and my lower back that I decided to sign up for the 12 weeks. And I remember seeing Vicki for a face-to-face consult in her beautiful little clinic there. And she had my neck doing things that my doctors had told me for years it would never do. Oh, no, your neck is fused from C1 right down to C5, and it's never going to, have that range of motion. And then at one point I said to Vicki, she had her hand under the back of my shoulders and my head was tipped back, and I said, my neck doesn't do that. And Vicki said, well, it does now. So, it's nothing short of a miracle. And as much as I thought that it was all a bit of a scam and a bit of hullabaloo at the beginning, now I'm one of Vicki's biggest advocates. Anybody says, oh, I know a lady who can help you with that. Yeah.
Yep. And so, Maggie, you've had huge changes. I noticed you said just a little while ago that you now can turn. When I first met you, you used to turn like this, like your whole body would turn.
Yes.
Yeah. And wow, look at that.
I can drive and go to change lanes, and instead of having to go like this, I'm just like, okay, maybe we go. Yeah.
Fantastic. So we're going to play with some of those things that Maggie's been using. Do you want to see how easy this is? Okay. So I have been asked to. So Vicki, you've got issues underneath your shoulder blade, and that is we might see if we can do that. It really requires a little bit more time than we have today, and because it's I believe it's one of the ribs, it's not sitting in place, and part of the reason it's not sitting in place is because the shoulder blade's not sitting in place. And this is one of those things that I talked about, is that when we're not in alignment, our body can't use, because the shoulder's a really complex joint. Like, you think of all the things we can do with our arms, and we've got this pathetic little ball and socket. Like, the socket is about the size of your thumb, and it's about that deep, and it's got a little collar of gristle around, and it's got this little ball half the size of a golf ball that fits in there. And we have sacrificed strength for function. And so we've got all these rubber bands holding it together in all different directions. And our shoulder blade is like the dock, where a lot of those muscles and tendons join up to. The other place is the spine. So they join up to the neck, the skull, and the spine. And it's one of those connections that is causing you, I believe, is causing you the problem, Vicki. And it's because of your shoulder blade and the way your shoulder is sitting, your arm is sitting in your shoulder. And quite often when you've got that happening, you've also got tenderness down here when you do certain things. Yes, they're all related. They're all related. So we're going to play. Let's play with some of the gentle movements that Maggie was talking about. We're not going to do the advanced moves that she is now doing. We're going to do the beginner ones. And so just going to turn, so you can all turn your mics off so that you can ask questions and whatever. So just get my chair right. So you're going to turn your head one way and turn your head the other and see which way feels easier.
Left.
Left?
Mm-hmm.
Okay, so you're going to choose your easy side, and then you're going to do about 50%. So my left is actually my easy side today. So when I go left, this is as far as I can go. But if you know those toilet doors that sort of unwind themselves, they sort of swing closed or swing open. Okay, so if I stop using my muscles strongly and allow it to relax, this is my comfortable position. That's where I'm going to start from. So just, Vicki, if you can let go a bit, just let it relax just a little bit more. And you're just going to, wait a second, you're going to put so if you're facing left, then your right ear is facing more forward. So your right hand's just going to come up to your ear. And you're just going to hold your hand there. You're not pushing it. And you're going to gently, 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 like about 10%, start to try and turn toward your hand, but your hand is stopping you. And then let go and move toward the other side. Other way, Vic. Other way. Yep.
Huh.
Mm-hmm.
Mm-hmm. Easy.
It's so
I swear she's got a magic wand down there somewhere. That
Oh, yeah. You might have been burnt at the stake for this knowledge a while ago.
I think I probably will be one day. So then we're going to do ear to shoulder, ear to shoulder. Oh, clunk, clunk.
Oh, yeah.
So my old neck injuries are still there. Like I've got arthritis in there, and so they still play up from time to time.
This is just ridiculously tight.
Okay, so you're going to go the other way. Go the easy way.
Okay.
And now, so your the ear that's facing up,
Left.
you're going to pop your hand just above your ear.
Yep.
You're not going to push or pull. You're just going to have your hand there like, hi, how are you? And then you're just going to hug your head into your hand, just gently sort of, so there's a little bit of tension in the muscles. You might feel a yawn or a sigh or a deep breath. Good on you, Nicole. 10 extra points for yawning. And now let go and see if that neck is a little less crunchy.
It's a little less crunchy.
Yeah.
Yeah.
And then the last one is chin to chest, chin to ceiling. Just go slowly. You don't want to be giving yourself a whiplash. Chin to chest, chin to ceiling. Which one's easier? When you go slowly, which one feels easier? You've got your easy ones?
Yeah.
Yep,
Chin to
that's
chest.
easy. Yeah,
Okay, so Nicole, yours is back, is it?
Yeah.
Okay.
mine's back.
You're both back. Okay, Maggie, you know what yours is. I don't need to instruct you. So if it's back, you don't go all the way back. Go back to the place where it's easiest. So it's probably about 50%. Then you're going to pop any hand on your forehead. And again, your hand is there as support. And you're going to try and imagine that your neck is long, but you're also hugging your head into your hand. So you can just feel that, you can feel the muscles of your neck just tighten up a little bit. We're going to do that for about 7 seconds and then release and take your head down.
I still get surprised by it.
Yeah.
Okay, now just move your head around and see. So we've normally we'd do 2 repetitions or 3 repetitions of each one. We've just done like a little, dip in. How are you feeling? What are you noticing?
So I have actually a very warm, relaxed feeling down my right side. When I first moved my head, I could literally feel it pulling even underneath my armpits.
Ah, yes,
That's even better.
yes,
Thanks.
yeah. All right, let's play with that shoulder.
Okay.
So your shoulder that's sticky, we're going to like hike it up.
Hike it up
And then see how I've got my other hand underneath. And so now I'm going to let my shoulder rest down. So I hike it up, get my other hand in there. So this arm is in nice and tight. We're supported by my body. And then I'm going to let my shoulder blade slide down and back. I'm not pushing it. I'm just letting it slide down and back.
Yeah.
Now we're going to do that little hug. You're going to hug your elbow into your hand, going down and back. It shouldn't be hurting. Was that a hurt noise that I heard, Nicole?
Yeah, I just got a sharp pain in the back.
Okay, so we need to do something different for you.
Okay.
Okay, and then let it down. Move that shoulder about, see if it's a little bit easier.
Just incredible. I have been trying to explain to Nicholas Blewett in class that I actually can feel my shoulder blades now. That sounds bizarre. I know where they are. I know I have them, but I haven't been able to feel them for years.
Right.
But now I still have this residual thing, which is why I'm coming to see you, because I want to get rid of that. And I do think that it is out of alignment because of the car accident and probably years of overcompensating for that. But now I need to try to get it fixed.
Yes, yeah. Yes, I agree. And like we're not even really touching the surface here.
Exactly, but I can feel that already.
Yeah. So Nicole, when you took your shoulder up, it hurt.
Yeah, just that, just a sharp, nervy pain in the left.
So see if this one works for you.
Ah, yes, those ones.
Yeah. And so you let your shoulder blade relax down and back and let your weight just, so which way am I going? This way. So let your weight just feel comfortable there. And then pop your hand on your breastbone and very gently, I'm going to turn around again. This is why a rotating chair is handy sometimes. And you're not going to rotate your shoulder, but you're going to rotate from the midline as though there's a rod here. And when you try to rotate from the midline, you can't go very far. It's only maybe 0.5 centimetre, maybe 1 centimetre. So you're rotating away from your shoulder, not toward it. There's my release. There's a bigger one. Oh. Okay. Now see how that shoulder blade is for you.
Yeah, that's better.
Yeah. So,
now I remember why I had the cushion on the chair, because this was too high. The back was too
yes. Yeah. So we have played with a couple of really simple movements, and you can already see what a difference it makes in your body. And so, Maggie, we've been working together for a couple of months now.
Yep.
What have you found in the progression of the sort of understanding of your body and using these techniques at home? Are they time consuming? How do you make it work with your day?
Well, I am a coach myself, and I'm also a writer. So I spend a lot of time sitting at my computer, and I just find that they can, people don't even know what you're doing. You can be talking to someone on a web chat and going like this, and they just think that you're fixing your hair or something, but you're actually doing one of these little exercises. And because I tell my clients, keep your joints mobile, and because I work with people with chronic pain as well, they just think that that's all part of and I see them mirroring sometimes and doing the same things. So it doesn't take any time. And then when I get up in the morning, as I'm standing at the counter making my coffee, I might be doing some lower back exercises, or it just kind
exercises in inverted commas.
Yes, because they're not exercises at all, they're just little techniques, but yeah, they just fit into your day. And then if I find that I've been sitting for a while and I'm feeling a little bit hunched up or whatever, I just do these little releases, and it takes less than 10 minutes or less than 5 minutes just to and when I look at my screen here, when I first started, I was kind of like this shoulder used to droop down, and I'm like, hey, look at my shoulders, I don't have that lopsided coat hanger anymore, which caused one doctor to think that I had Arnold-Chiari syndrome, which I don't, thank goodness.
Yeah,
which is a brainstem disorder. But
my goodness gracious,
yeah,
don't they love giving things a name?
They just it's like it's this thing where your spinal cord is taut and it pulls the brainstem down below the base of your skull. And yeah, I didn't want that one.
No, that's one definitely not to have on your report card.
Absolutely.
Yeah. Yep. So that's how my work works.
Yeah.
It works by supporting your body. I have an unshakable belief that the body knows how to get well.
Yes.
It just needs the right information.
It just needs us to listen too.
Yes. It needs someone to listen, and the someone needs to be you. But if you haven't been taught what to listen for, it's like trying to explain. It's like trying to explain sounds to a deaf person or colours to a blind person. And that's one of the main. The first part of the program is awareness, because until we have awareness of what's actually going on, because you know that you're crooked, but where else are you crooked? How is that affecting my walk and my sitting and my moving and my neck and my all of that stuff? So we know one part of it, but we haven't got the whole picture. And most of us can't imagine ourselves 3D. We can imagine ourselves like this because that's the bit we see. But when we start to feel what's between A and B, that's when we start getting a whole lot more information, and we can start working with that. So awareness is really important. And I work through awareness with every session. We do an awareness part. Now, I want you to do walking, or I want you to do a movement and tell me what you're feeling. We do the release position, and then we go back and do a check. Okay, what's different? That gives me my next piece, what's happening after that. But it also gives your brain, because you've got to remember the brain's masculine. It can do one thing really well, and it doesn't like confused information, and it doesn't like being nagged. So you give it one piece of information, it knows what its job is, it goes and does it, And then you go, well, job well done. Thank you very much. Appreciate that. And it remembers it and does it well the next time. So it's a simple principle and it works, which is what I love about it, because for years and years and years, I was doing stuff. I was doing so much stuff. I was doing breath work. I was doing qigong. I was doing yoga. I was a classic walker. I walked miles and miles and miles. None of it helped. It probably did help, but it didn't stop me from getting into a position where I was, unemployable. And so, yeah, that's how I work. I do have a 5-day challenge starting next week, Monday to Friday. Also realizing that Friday is
Good Friday.
Friday is Good Friday. And Vicki, you in the UK?
No, I'm in Perth.
You're in Perth, so it's just 2 hours behind.
Yeah.
So it'll be, I'm thinking probably the same time. It's somewhere around this time of day.
That's cool for me.
No good for you?
That's good. Perfectly
is good
for
for
me.
you.
Absolutely.
Yeah. So I've got another lady who's not on who wants to be part of it as well. So I need to clarify with her about time, but I'm thinking sort of this mid-morning type time, be for an hour a day, and we'll work together and work with the issues that come to hand. And my aim is that you get to have the most amazing result at the end of 5 days and become like Maggie, one of my best, one of my fan club,
Yeah.
and get well, in the process. So excellent. So if you'd like to stay on and ask some questions, Maggie, I hear you got to go. So I really appreciate you being here, and thank you so much. And
Bye, everyone.
Thanks for sharing.
Bye-bye, Maggie. Thank you.
Thank you.